Hello, good day. I'm Boo Verdi, the Cloud and AI Program Specialist here at Intelisys. I happen to be joined by Alex Brown with PolyAI to talk to the opportunities and challenges within the healthcare vertical. Alex, do you mind introducing yourself?
So PolyAI builds voice and conversational agents that handle high volume patient interactions. This could be appointment booking, triage, follow-ups. We integrate with the existing systems to automate these conversations, and then while maintaining a natural kind of empathetic flow for healthcare customers. I'm Alex. I sit as the Director of Strategic Alliances within Poly, which means I help handle all the integrations and partnerships with the health IT systems to make sure that we're driving revenue or helping with operational efficiencies.
Thanks for being on here. Let's start off with a question I think I see a lot in the industry, which is really based upon like outcomes and ROI, basically. So, what are the top two healthcare outcomes your solution improves, and how do you measure them, let's say in the first 90 or 180 days?
I would say for all of our healthcare deployments, the first thing that we normally measure is improved access to care and kind of healthcare access. So the way that we do that is we shorten the time from a patient calling in order for them to kind of get in touch with a medical receptionist or clinician. We reduce average handle times, and we kind of take away that main barrier of patients waiting on hold. So that's kind of within the first 90 days across all our projects, independent of the workflow. The second usual metric that we take track, and this kind of depends on what our healthcare customers want to do, has to do with actual patient adherence. So we handle inbound calls, but we also handle outbound. So what we do is we phone up patients, whether it's a medical resupply or a prescription refill, and we just make sure that the timing is right to make sure that they're sticking to their care plan.
Wow, that's great. Let's move on to the next one because I could see how that level of timing and efficiencies really helps with the overall healthcare experience. What healthcare environments does Poly AI typically fit into best? Like an example, IDNs, community hospitals, clinics, et cetera. Is there a certain area where you guys fit the best in?
Absolutely. And so we tackle kind of the end-to-end spectrum, we'll say, of healthcare, right? So what we do in the provider space, which is exactly the ones that you kind of listed, we also do medical device and pharmacy and things like that. Where we've seen historical traction has definitely been in the outpatient specialty ambulatory space, right? We have a high volume of patients coming in, usually appointments in and out. There's a lot of logistics and front office burden that we can kind of alleviate off the bat. What I would say now, as kind of we scale and people get a little bit more comfortable with I would say where we also see ourselves now is kind of on the revenue and the billing side. So collections, back office, that side of the patient journey is definitely something we're also tackling for those providers.
So let's talk a little bit about infrastructure, cloud, network, other types of things that people are deploying or they're consuming as a service. Is there an area that often causes your AI or security, or let's just say, are there challenges in those specific areas that you guys see the most?
And I know, having spoken to you, you want me to say cloud. Actually, on the cloud side, we've actually got, because of our multi-cloud tenancy, quite good uptime. So it's actually not the dependency of the AI robot that usually kind of challenges our, we'll call it use case and workflows. Where it normally comes in is specifically for healthcare, is around kind of those integrations. So I'll take it back here a moment. When you pick up the phone and you say, "Can I book an appointment?" The AI agent is only as good at doing the task as kind of the systems it has access to. And specifically in healthcare, when you have these old systems of record, I'm talking old school electronic health records sitting on prem, having kind of firewalls, not offering APIs, sometimes that limits our AI agent in what it's able to do. What we've been really good at within Poly is kind of forming relationships and direct contracts with those systems of record, finding workarounds to make sure that our agent can actually complete the task. And then ultimately, as we talked about the metrics at the beginning, hit those kind of patient access or containment metrics that we've agreed with our client on.
That's great, and I'm glad I got you to say cloud. That was a thing of mine. So, um, as HIPAA security rule modernization heats up, what controls or capabilities do healthcare customers most need to strengthen, and where do you plug in?
So when our customers talk about HIPAA, right, they need to make sure that we can enable them to remain HIPAA compliant, and that's exactly what we do. So we sign a BAA with them to make sure that HIPAA compliancy is there, but then more importantly, we provide kind of the guardrails and the controls within our platform for them to ensure that they can properly report back. An example of this is we handle FAQ appointments, right? So there's a lot of patient health information in there, a lot of PHI. The controls that we have on our side are kind of multi-layered, right? So we have full access control. So not everyone at your organization will have access to the PHI data, right? You can divide that by super users, admin, people that can just screen kind of conversations. What we also layer on top for a lot of our healthcare customers, using a Microsoft Azure tool, is the auto redaction of PHI, which helps you really become HIPAA compliant, meaning that a lot of people who have access to the platform do not actually have access to the PHI of the caller, which is extremely helpful. In addition to that, we provide dashboards, reporting. We have alerts that can kind of trigger any emergency phone calls or patient access requests, all which encompass kind of a HIPAA profile that our customers can then use for certification.
Next question I have is I'm near and dear to, which is really revolves around cyber resiliency, data protection. There's a lot of terminology as it comes to it, but it's basically uptime, right? Is what it boils down to. So, kind of the beyond the 99% SLAs, what must the local cloud network stack provide to ensure zero patient impact?
Yeah. And so I would say we've thought about this long and hard. And at Poly, at least, we say the AI is not there to put up what we recommend to our clients. It's not like a full stop, right? If a patient wants to reach a healthcare professional, we should always make that possible, right? And so depending on the customer, they have different levels of control and how much we want automation. But to your point about uptime, it's very similar to that. We have kind of what we call a fail-safe, that if our AI agent is not able to pick up the phone, it then hands it back to the human agent, right? The human agent is always in the loop, in our sense, to make sure that no patient call goes unanswered. Again, you might kind of go back to historical average handle times. If you've reconstructed how your call center works, right, those may actually be increased. But I would say that is very rare, but we want to make sure it's possible so that your calls don't kind of get lost in the abyss, or fall into a dark void.
Great, thanks for that. What are the top three implementation, we'll call them challenges, you see in the healthcare vertical, and what does a fast but safe rollout plan look like?
Great question. And I'm deep in these now, right? What I would say is the first one, and I think I mentioned it before, is interoperability, right? Um, what a lot of teams discover as they kind of start deploying is use cases that they had in mind. If their systems are decades old or it's sitting on actually a Google Sheet we can work with now, but sitting in a closed off system where we can't access that data, um, one of the biggest things is kind of figuring out workarounds in order to make sure that our AI agents can handle those workflows. One of the second things that we normally handle here is vulnerable customers. So, especially in healthcare, you're going to get a demographic that is potentially needs a little bit more handholding. Maybe they have comorbidities, maybe they don't feel so comfortable using technology, right? What we want to make sure is that we're able to identify those customers up front and work with you to segment your callers to make sure that those get handed off to a human as soon as possible. And then the third thing that we normally deal with, especially in the healthcare space, is around kind of terminology. So every specialty will have their own terminology. And then I will even say at a clinic level, sometimes they use slang or words that are kind of models which are trained on hundreds of hours or thousands of hours of customer service calls may not have heard, right? I'm thinking about physician names where there's a nickname or they're from a very kind of regional accent and may not be able to predict. What we then work with you is to kind of upload those in what we call ASR biasing. So speech to text biasing, where we make sure that for your deployment specifically, you're able to make sure that when people speak those words, our system is able to comprehend it. So those would kind of be the three: interoperability, vulnerable callers, and terminology. Boo, to your point on what does a deployment work look like? I would say we normally start out, at least in the healthcare space, at least in patient engagement, with a crawl, walk, run approach. So in the crawl space, we normally have things like frequently asked questions, existing patient reschedules, right? Things that are very bread and butter and serving people that are very familiar with your brand already. What we then kind of go into is the new a patient, right? So how do you want that new experience to land? It's a little bit more complex. Potentially you have insurance validation or kind of new patient intake forms that you need to kind of update. Lastly, what we then kind of see is this run use case, right? These are the more complex scheduling, those edge cases, those doctors that only want to work on a Tuesday but don't want to update their schedule. That's where we try to hit kind of the really high level of AI automation for call containment, making sure that we got that, if you think about the 80/20 rule, the 80 already solved.
Great, thanks. That's very comprehensive. Appreciate that. Let's end with another, let's just say, kind of compliance type of question. And I always like to have an idea of all of our suppliers and what they can do from an executive standpoint. So we know we've got checklists for like SOC 2 and HIPAA and high trust and all those other things. But in terms of a dashboard that we can put in front of executives like a CISO or a CIO, what does your dashboard provide for kind of auditing, proofing, things like that for like real-time telemetry?
Absolutely. And I think my dashboards team will be very happy. So our dashboards are fully customizable. So we have out of the box healthcare dashboards, as you would expect, to track things like average handle time, uptime, things like if we're doing appointment flows, right? How many cancels was the AI agent able to convince a caller to reschedule so that there was no revenue loss, right? We've got exciting healthcare dashboards which show you if you're a multi-site clinic, right? Where is kind of high volume of where people want to book? Where are they getting denied because there's no empty slots? So we've seen that kind of across the span. What I will say is we also have this tool called Smart Analysts, which think of it as I describe it as kind of a GPT, where the only information it has is all your transcriptions of all your calls, right? And what you're able to do, very similar to what you would do kind of in a GPT or a Claude, is investigate it. So if you have a board meeting coming up or an exec meeting and you're like, why are people hanging up? Or why did we see an uptake in new patient signups this week, right? What it's able to do is investigate all the transcriptions of all the calls and actually build you out a summarized view and a graph or a PowerPoint as to kind of what the data is pointing to. What we've seen in companies is that it actually highlights a lot of process gaps or marketing initiatives, right? So, for example, outside of healthcare in FedEx, they found out that on their website there was actually a mistake on when you should pick up, right, your passport, and it was causing all these disruptions. And so what they were able to do is actually work with their contact team to update their website as well as update their process. And then we were able to kind of, you saw a massive drop in the number of calls on that specific topic. So again, using those tools, I would say the custom dashboards as well as the Smart Analyst tool to kind of inform those exact meetings is where we see the most business benefit, we'll call it.
Yeah, and I bet those are highlighted very well during customer engagements and stuff. So glad to hear all that, Alex. Thanks for being here. Really appreciate your insights and your look into what PolyAI is doing in the healthcare and AI space.
Thanks for having me. Super interesting conversation and look forward to many more.
So if you'd like to learn more about PolyAI and how you can implement them, please reach out to your business development manager. Thank you. Goodbye.